I'm Dr. Sam Tocco, and I'm a doctor of chiropractic. And the reason why I'm here today, I'm with one of our patients, Mr. John Nagel, and we had an incredible experience occur here in our office some months ago. And John and I would just like to share the experience. John, what first brought you to our office in the first place?
Well, it's kind of unusual. I never thought I'd be in this position. I worked 8-10 hours outside, and I cut down a lot of trees, over a couple hundred trees I was cutting down, and I was tilling my garden, and I got a lawnmower that you got to yank the chain to get it started, and I got a tiller you got to yank the chain. And so I was really going at it because I started to eat a lot better, and I felt great. I was losing the weight that I wanted to get rid of, and I felt like Superman. And all of a sudden, after doing all that work all spring and summer long.
This was last summer, of course.
Yeah, this is last summer.
That's right.
Right. And my arms started to get a little sore, and I just attributed to just too much
wear and tear
with the cutting down the trees and lifting the logs and everything. And I have a tractor that I run also. And lo and behold, it starts to get a little worse, and I'm trying to tough it out. And then all of a sudden, I'm not sleeping well at night, and I had to sit up in order to get rid of the pain that was in my shoulder.
John, I told you that we look at both shoulders and compare both of them.
Yeah, right.
And so when we looked at both of them, we didn't seem to see that they were a whole lot different.
No.
But to make a long story short, it's like a video X-ray, if you can imagine that, and we're studying the joint in its full range of motion and looking at the whole joint all the way around. And actually, most joints of the body get in trouble when they're in motion.
Yeah.
So you need to look at them in motion. In your case, you had a hard time moving the shoulder.
Yeah, you could even could even tell where the pain was. It was. That's the best thing that I think was ever invented.
I didn't know I was going to work with you, and you didn't know I was going to work with you either.
That's right.
And really what you were doing, John, I believe, is you're coming here to get me to get a good look at your shoulder so that your surgeon can really see your shoulder as well. And then what happened was, after I looked at both of them, I didn't see a whole lot different, and I knew you had never been under chiropractic care. You were 79 years old.
Right.
And I knew you had a lot of accidents and injuries from sports and so forth.
That's right.
And then I asked you when we were back there, you may remember, I said, John, if you don't mind, can I just look at your neck? And I told you I would just throw it in. I was going to charge you for it. And when I started to look at your neck, I saw lots of problems with the bones in the neck, and lots of spurs and lots of decay and degeneration. And in my mind, I really thought that this pain and malfunction in the shoulder was really because of this. And most times, when we look at people medically, we're just looking at the part that's in trouble, but we don't consider anything else. And I'm the opposite, and that's what probably your friends were trying to tell you about me, is I know that most times the neck is like the fuse box of the body, and we can learn a lot about the whole body through looking at the neck. So I went ahead and I looked at your neck,
started working
and
on
then actually I saw you on a Thursday, and you were supposed to have this surgery 12 days later. You live in Linden, Michigan, which is quite a distance away from here. And then you were ready to walk out my door, and I don't know if you remember this. I was going to let you go and come back on Monday to pick up your x-ray to have it ready for your surgeon. And then right when you were walking out the door, I was thinking to myself, John has never had chiropractic care in his life. And I said, John, would you mind if I just throw in an adjustment? And that's what a chiropractor does. He adjusts the spine. And I went ahead and I adjusted you. And then you got off the table, and I think you said it felt a little better. And I didn't think nothing of it. I just said, well, that didn't even. And then you came back on Monday, and I think you slept better.
That's right.
What it was.
That's right.
And then you
slept
asked
better
me
that night, and the next night I slept even better yet.
Good.
And after that, I was sleeping fine, and
then I took care of you on Monday again.
Swelling started to go down.
Yeah.
And I came back another 5 or 6 times, and I have to tell you, it's better now than it ever was.